Hello friends, hope you are all doing good. So today we are here to discuss some exercises that will help us to keep our lungs fit and healthy. So friends, let's start. It is essential that we take care of ourselves during times like this. Our lungs are very sensitive and despite being internal organs, they are continuously exposed to our external environment with every breath that we take. This makes them vulnerable to dust, pollution, as well as respiratory infections, and we need to protect them by practicing good hygiene. As even in a yogic sense, these lungs are primary organs that help us control and enhance prana or universal life saving energy. That is why breathing exercises in yoga are all called pranayama. These methods improve overall health, giving us greater vitality, managing stress, and enhancing our immunity. In today's times, pranayama practices have become especially relevant as COVID 19 is a respiratory infection that attacks our lungs. Therefore, along with diligently practicing preventive measures like washing our hands, wearing a mask, and social distancing, we also need to work on interventions that can keep the lungs healthy and strong. So, here are the four ways to strengthen our lungs. First in the list is practice Surya Namaskara or sun salutations. Surya Namaskar is a sequence of 12 yoga poses that you practice in coordination with the breath. Therefore, it is a dynamic combination of pranayama and asanas and give us the benefits of both. More importantly, in sun salutations, you alternate forward and backward bending movements with designated breathing patterns that give an excellent stretch to the spine and the chest, improving overall oxygenation levels and strengthening the respiratory muscles. Across medical research, Surya Namaskar has shown improvement in breathing capacity and respiratory endurance because it improves our inhalation and exhalation capacity. It would be best if you aim to practice 6 to 12 rounds of Surya Namaskar a day at a moderate pace, which doesn't leave you completely breathless. One round includes both the right and left sides. So, in our list, second pranayama is Adhanam pranayama, which is deep belly breathing or diaphragmatic breathing. This is foundational breathing practice that help us correct our breathing pattern. To do this practice, you lie down on your back with the knees bent and place one hand on the belly above the navel. Then you breathe in through the nose to draw the air into the deepest parts of the lungs. As the lungs expand with air, they push the diaphragm, which pushes the abdomen out. You will sense that as the hand on your belly will rise when you inhale, and then you can exhale normally. There are many variations of doing this exercise. First is pursed up breathing. Instead of exhaling through the nose, you can exhale through the mouth by pursing your lips together. This is called pursed lip breathing and is also very useful for improving lung capacity and is suitable for senior citizens. Second is prone breathing. You can practice deep breathing when lying down in a prone position and resting your head off the back of your palms, like in Makar Asana, which is a crocodile pose. This anecdotal news of COVID 19 patients benefiting from prone position, especially those on ventilators, as it reduces the pressure in the lungs. In Hatha Yoga, this is considered a good position for training the lungs for pranayama. These methods help us activate the diaphragm and dormant areas of the lungs, remove the stale air that may be trapped in the lungs, and increase our overall breathing capacity. You can practice this for 5 to 10 minutes daily on an empty stomach. Third in our list is Kapalbhati. As you all may be aware of this, which is also called as skull shining breath. This is a vigorous breathing practice with short but intense strokes of exhalation done in rapid succession. Inhalation is passive in Kapalbhati and happens effortlessly. This practice helps us train the diaphragm muscle, forcing out the stale air from the lungs, thereby creating more space for more fresh air and clearing out the nasal passages. This is heating practice and should not be done by people with blood pressure, dizziness, or heart issues without consulting their physician. You can practice 3 rounds of Kapalbhati and can build up to 100 breaths per round. This should be done on an empty stomach and is best done before starting your yoga asana practice. And the last in our list is Nadi Shuddhi, which is also called alternate nostril breathing. This is calming and balancing pranayama practice in which you breathe in and breathe out from alternate nostril at a time, very slowly. It is also one of the oldest breathing techniques which are found in many yogic texts as it helps you to cleanse out your energy channels, making you light and clear headed for meditation practice. Medically, it has been found very useful in managing stress and anxiety and improving breathing capacity due to the slow nature of inhalation and exhalation. This also gives the lungs more time for gases exchange, increasing the breathing process overall efficiency. We should also note that reducing stress and anxiety is also a significant positive effect of this practice. Lungs are very sensitive to stress, tightness to the chest. It doesn't help that this resembles one of the symptoms of COVID 19, further adding to our mental stress. Nadi Shuddhi can be practiced for 5 to 10 minutes on an empty stomach. It is best done after yoga asana practice, as after some physical movement, both nostrils will be open, allowing you to breathe comfortably and evenly on both sides. Lastly, none of these exercises should be done in crowded, polluted, or unhygienic spaces, as when you take deep breaths, you can carry the risk of drawing pathogens deep into your lungs. The fresh early morning air in a private space is ideal. Regularly doing these practices will help you maintain good health and vitality, as yoga practices work on both our body and minds. So not only do we develop a good immunity, but also we develop the mental resilience we need to deal with this pandemic, and that's a win-win situation. So friends, I will conclude here. Thanks for watching this video, and if you are new to this channel, please subscribe to